And every year.
I just want everybody to, I know we're having fun, but it's time.
You need to go.
Sorry.
Boing, boing, boing.
Well, good morning, everyone. I'd like to welcome you to the Public Health and Human Services Board. We're calling it order today at 8:30, Tuesday, December 19th. And the first thing we want to do is have an approval of our consent agenda. So is there a motion to approve?
So moved.
Thank you, Commissioner Hawkins. Is there support?
No support.
Thank you, Pat. So we have a motion and support. Any further discussion? Any further discussion? All in favor?
Aye.
Opposed? Motion carries unanimously. All right, we'll move on to our staff reports. And Allison.
Sure. Before we move into our staff presentation this morning, I'm really thrilled to welcome Leonard to the Public Health and Human Services team. Leah started on December 12th as our accounting technician with the department. Our account team is now fully staffed for the first time in 6 months after a series of internal promotions following Lori's resignation in June. So really glad to be fully staffed on the accounting team. It's such an essential function of our department and our support to residents in Cook County. So welcome, Leah, and you're welcome to say a few words or comment if there's anything else you'd like to add.
Yeah, sure. Good morning, everyone. I would like to introduce Leah Leonard. She was born and raised in Grand Marais and Cook County High School alumni. We are so thrilled to have her. She comes with a lot of experience from a different variety of work she has been doing during her professional career. I'd like to say thank you for joining our team, and I'm really looking forward to working together.
Oh, thank you.
Anything you'd like to share with us, Leah?
Nothing specific, just happy to be here and get trained in on my new role and be useful to the PHHS team.
Well, thank you very much. We appreciate you joining our team, and if there's any support you need, you have a whole load of people that are willing to
Thank you.
assist you, so welcome.
Thank you.
Thank you so much. Commissioner White?
You're suggesting that I'm going to help her with spreadsheets?
I did not say that specifically.
You know.
All right, great. Well, welcome. Thank you so much. All right. So Allison will continue on with the staff report at this time.
Excuse me as I transition our audio here. So excited to welcome our behavioral health team for the staff presentation today. Again, a very relatively new team of staff to our department, already doing fantastic work in support of our county's most vulnerable residents, both youth and adults. So I know that Commissioner White got a preview of this presentation at our Mental Health Advisory Council meeting last week, but hopefully a lot of great information to share on their work supporting residents in mental health. I'll let them introduce themselves and share their report.
Yeah, I think we're going to do more introductions as people present instead of just doing it all right now. So we'll
That sounds fun.
get right into the report. If that works. Good morning, and thank you for having us to be able to talk about our behavioral health team. We're pretty happy to do that, and excited about how things are unfolding and developing. So the folks you see behind me are the behavioral health team as it exists currently. They have all been hired sometime in the last 11 months, so it's a brand new team. I think Dana and Brenda are about 7 months into their job, and Al and Merrisa are about 3 months into their job. So, but they're going to tell you about what they would do and what that looks like from a case management perspective, and so and their voices are way better than mine, so I'm excited to have them be that voice. I'll just point out that what's not part, Greg Barnier is also part of our behavioral health team. He's our, contracted LADC with wilderness outpatient, and we'll see it later. But we're currently have 2 FTEs that are unfilled as part of the behavioral health team as well. So this was a new team, and we formed in January of '23. That's when I started. Allison and the team did other planning in front of that. I don't know what that was exactly. I can speculate, but so we really began as a team in January. It's made up of children's mental health case management, adult mental health case management, mobile crisis response team, substance use disorder and mental health co-occurring case management, and then finally wilderness outpatient comprehensive assessment and outpatient services. Mental health case management, I think just it's important that we start with what is mental health case management. It is a statutorily defined service, and it's generally referred to as targeted case management. And so the county has a mandate to provide the service to eligible people. And so that's why we exist, to support folks who are eligible to achieve stability and or avoid additional crises in their life. Because we're really looking to create a better standard of, or a better threshold of behavioral health in the community for individuals, and that contributes to the overall well-being of the whole community. It is a reimbursable service, there is criteria for eligibility. So it is not something that anybody can just walk in and say, oh, I want case management services. You do need to be, there's some criteria for eligibility. And that generally includes a diagnosis of a certain type and then on medical assistance. As I mentioned, we're promoting, the point of mental health case management is to promote mental health recovery and stability through service coordination. And the other point that I want to really make is that case management is a voluntary service. Clients really need to show up and say, this is something I want, versus, the county stepping into someone's world and saying, you're going to have case management. Now, there's some caveats to that. If you're in CERC, you've made a decision, or a substance use recovery court, that individual has made a decision to participate in CERC. If you're involved in CERC, you are really expected to participate in case management services. If you're under a mental health commitment, there is also an expectation and that you're going to be involved in case management services, and or in some cases, there's a court order for someone to participate in case management services. In almost all of those situations, though, that individual still has choice, because they have to decide for themselves if they're going to want to recover their health experiences or not. And if they don't, we can't really do much about it. So we can report that information back to the courts or to CERC, et cetera, and there will be legal consequences at that point in time. But so the individual choice and voice is really, really important to an effective case management relationship. As I mentioned, choice is very important. And for me, that's a foundational piece of the whole field of social work. The individual has their participation and their voice is so critical to anybody's success. So we can't ever, the idea that people are forced to participate or they're without options is really not an accurate perspective. And so it's part of our job to really always be promoting that to the individual about what choice are you making, what would you like to have happen in your world, how do you want your world to improve, so we can support you to that end point. Autonomy is of the individual is always the goal. Case management has a beginning and an end point, so it shouldn't be where someone stays on a case management caseload for the rest of their lives. If that's the appropriate thing for someone, then absolutely we will provide that service. But ultimately, we're looking at autonomy and independence. So we really think about that as there's a beginning, and then you work on goals, and there's an end point. And someone is discharged, and they move on with their world, and they don't need to be involved in county services. Inherent in that is change is possible across the whole lifespan. So that is really what our team looks for, is we're always promoting change within the individual and in their environment, and that's what's going to help them have the life that they're looking for. Go ahead. So I'm going to turn it over to our brand new children's mental health case managers, Merrisa and Al. So I'll turn the mic over to them, and they will do a brief introduction of themselves as well.
Thank you very much. Good morning, Melissa and Al.
Hi, I'm Merrisa Chapman. I'm a licensed social worker. I'm one of the new workers here. I've been here for about 3 months. This is my work-life partner, Al.
Good morning. Merrisa and I started on the same day, September 18th, and since then, we've been really working well together as a team, so that's been fun.
So we really want to talk about like why children's case management is needed, especially within this small community, right? And what we're going to be doing to be effective within this framework. So we really want to focus on this time where developmental stages are really critical for children. Mental health ends up being very critical for them during that time, so that's why we do a lot of screenings and assessments for them to help get them connected to the correct services. So we don't provide those services ourselves. We're going to connect them to the services and the professionals that they needed to be connected to. We're also going to make sure that we're looking at preservation of their emotional well-being for, a lifelong. We want to make sure that once we close this case, they have lifelong skills and coping mechanisms that helps them hopefully never come back around as an adult case, right? We want to make sure that we're setting up these children for success for the long run. But some of the statistics that we pulled is like 20% of Minnesota children between the ages of 0 to 17 have a diagnosed mental health disorder or a behavioral health condition, which could be like autism or ADHD or something similar to that. COVID-19, as we saw, and this was the same as in adults, we saw a mental health crisis explode. So we can only imagine how that affected children, and it just kind of did the trickle-down effect from adults to children. So we saw our children were even more affected. And then, of course, for many children and their families, mental health treatment just improves quality of life and positive outcomes. And I think we see that in our community all the time. The more people that are involved in a child's life that help them be able to have safe spaces, be able to have a safe place to talk, and feel that they're welcome, mental health improves, right? So that's what we're trying to help these children see and understand.
So some of the things that we do for families and youth is we help a family go through the diagnostic and evaluation process, so that can be helping them get appointments set up. And as we know, we're very limited up here in terms of diagnostic and assessments, so a lot of the times it's helping families get set up to go to Duluth, and if they were to ask us for a ride to and from, we'd be able to provide that. So it's just an example. We coordinate services, so that can be helping a family get therapy appointments set up, and if we're asked, we can help the youth get to those therapy appointments. And we do education and recovery, so some of the kind of education things we're doing is we've got a couple different youth groups that we'll talk about next. And that's also under our programming, and we're really looking at prevention and how do we intervene in youth's life before they get to the point where their mental health has become a challenge. So that's looking at different kind of programming and what we can do to work with youth as a whole in the community, and not just youth that are on our caseload.
So to add on to that, we're talking about what will we do. So obviously evaluations, diagnostic assessments. Unfortunately, sometimes we have to coordinate hospital stays if we're looking at children that are really struggling within crisis mode. Therapy services that could be outpatient or even maybe partially inpatient stays. And those sometimes, unfortunately, because we know, again, we're a small community, sometimes they'll have to be outside of the county, right? Obviously, we want kids to stay and their families to stay in the county as much as we possibly can. So we do have to work with families as well, too, within those wait lists and staying motivated through those wait lists, because that's really challenging as well. We may be really motivated, like right now, like let's get on the wait list, let's get therapy done, let's help this child and family. 3 months comes along, they've lost that motivation. They're like, you know what, we're fine right here, we're done. We don't want to deal with this anymore. So we really struggle in those parts as well too, in finding what we can do to help those families. We help payments and services for some of these families if they have any types of struggles that they may need us to help within that framework. We have payment services that we can offer for that. And we develop mental plans for growth and recovery, like we said. We want to improve these children's lives, to improve their skills, help them teach, we will help teach and model our skills to these children, so that way hopefully they can have just better success all around. So then going into our programming and prevention, we can kind of talk about the things that we've been really lucky to be a part of so far, and we hope that in 2024 we're going to have a bigger outlook of what we're going to be able to achieve anymore. So far we've done, Al, previously to coming to PHHS, started the LGBTQIA group, and that was founded underneath the PHHS grant. It was an initiative that was under the VPC as a physical sponsor. This runs every Tuesday night from 3 to 5:30 at the Community Center's log cabin. You do not have to be underneath the LGBTQIA umbrella to come to this event. This is just a safe space for kids, for them to come, to be with each other, to have fun, and to just relax for a couple of hours, to blow off some steam. We do anything from going and hanging out at the park, doing Dungeons and Dragons League, which we've seen a child that has really struggled to be able to share and express herself, step up and be the dungeon master, and they do wonderfully within that space. They're teaching and expressing themselves with other children in that space, and the other children are really responsive to that. Children will play video games while they're there. They'll play board games. They'll make buttons. They'll do art. I mean, it's a really great event every Tuesday night for them. We also do some social lunch. Right now it's on Tuesdays, but at the beginning of the year we're going to change that to Thursdays. And that's not, and just a FYI, the LGBTQIA is not just for people that are on our caseload. That's community-wide. Anybody can come. So same with social lunch. It started as being a group that was just for those within the caseload, but now we're opening up to anybody at the school that can get a permission slip, come on over. Because again, kids need that hour within the middle of the day to just have time to be able to relax, talk with other kids, build their social skills, and have some time within school just to have fun. Because school is really hard. I think we kind of forget that sometimes as adults, how daunting that is on an adolescent for school to be. And then just basic assessing families and their needs. If they need things like toiletries, clothing, whatever you can think of, we will help with that. This past Friday, we were really lucky to be able to take a couple of youth shopping to get clothing and toiletries, and we had so much fun with them. So sometimes it might seem like it's work, but it's actually been a lot of fun to be a part of this group.
And just the LGBTQA youth group, we're consistently having 15 youth coming every week from both the traditional high school and middle school and then Great Expectations school. So 15 youth for Grand Marais is a pretty large number. And this group was started to give youth who don't have access to sports or other after-school programming somewhere to go. Because that is still a great need in our community. You see like kids just hanging out outside the library or hanging out at Dairy Queen because there's not a lot of opportunity outside of, sports or the school designated activities. So, and that the LGBTQA and Native Indigenous youth, we need to have special considerations for those groups. From the Trevor Project's 2023 National Survey on Mental Health, 41% of LGBTQI young people seriously considered attempting suicide in the past year, and young people who are transgender, non-binary, and or people of color reported higher rates than their peers. And 53% of LGBTQIA plus Native Indigenous youth surveyed considered suicide, and 22 attempted, while their white peers were at a lower rate of 37% considered suicide and 11 attempted. and nearly 1 in 3 LGBTQIA young people said their mental health was poor most of the time or always due to current anti-LGBTQIA plus policies and legislation. And it's important to note that LGBTQIA plus young people are not inherently at risk because of their identity. It's because of how society and the systems react to them.
Yeah, and I think just to add on to what Al was saying, we, as we came through, we started identifying our caseloads. A lot of our kids were within these cultures. So we've really tried to identify as a group of being children's mental health, we have to do better as a group to help these children within these cultures to have more access to resources and to make other people and other children within this group understand the struggles that these children within these cultures are facing, right? Because that's what it means. Like, everybody has to know in order to make a difference and change. So looking to the future, we want to do lots more things with the LGBTQI group. We really want to start involving Grand Portage a lot more. We are in talks with Human Services up there to how that's going to look. How can we bring the group up there a couple of times a month or every other month, or however we can do that and it work out for everybody? How do we get more kids from Grand Portage involved in this event? And just how can we be more of service to that community in general? Developing more events overall for youth and families, especially because we know summer comes around, kids aren't in school, there's less to do, right? So we got to figure out in summertime, how do we keep these kids involved? So that's what we're going to be looking into as well too. Connecting with homeschool and online communities. I think that's a marginalized community that we don't really think of a lot here, because we think, oh, we see them in schools, we'll be able to connect with them, right? But if they're at home, we can't connect with them. So we need to start connecting with that youth as well too, to make sure that they're getting services or just getting involved in youth groups in general to get the help that they need. And just expanding all of our educational programs, really starting to broaden out, talking about, tobacco use, bullying, mental health, physical hygiene, safe talk, all of those things that we want our children, our community to know about so they can make informed decisions when they're out on their own and not with us. So we will turn it over to Dana.
Thank you very much. Good morning, Dana.
Good morning. Good morning, everybody. My name is Dana Logan. I have been here since April, and I first started working with adults providing skill work, and then in July I started doing case management. So right now I have 17 clients that I'm working with, and we are short one adult mental health case manager. And as far as the clients that I work with, I have people who come in and see me maybe once or twice a month. And sometimes I am on the phone with people once a day. So there's quite a range of different needs that people have that are using case management right now in the county. So we'll go ahead and get started with the definition of case management services. These are activities that are coordinated within the community support system that we have here, designated to help people with serious and persistent mental health issues or illnesses in gaining access to medical, social, educational, vocational, and other necessary services as they're related to the client's mental health. So clients come in and it is voluntary service that they are seeking. Some do have diagnostic assessments and some do not. Part of the challenge right now is with the shortage of accessible therapists to do the DAs. There's a huge wait list here in Cook County. So right now we are using other companies like HDC or Nystrom's in Duluth so that we can do telehealth or actual DAs online and getting these so that we have their diagnosis, because you need to have their diagnosis to know what kind of services they may need, because sometimes they don't even know. Getting their insurance, making sure they have insurance that pays for all these things, like the diagnostic assessment and the medications, therapy setup, is sometimes really daunting for them because they've never had insurance or they don't understand the insurance, and then they know what services they can get covered. Case management includes developing a functional assessment. So once they have their DA, and a lot of times they are working with a therapist, if they are not, I help them set that up and get that going. I work with the therapist to find out what their treatment plan is, and then client and I will develop a functional assessment to see how they're doing. We develop an individual community support plan, which can include people that they are in their family, friends. Who are their supports? Who here can support them, especially if they ever go into crisis mode? You know, can they call me? Yes. Can they call anybody within the service? Yes. But who else can help them until more help comes? Referring and assisting the person to obtain needed mental health and other services. So that is something we all do in case management, is we refer them, we help them make these appointments. And then once you do that, we want to make sure all their plan is solid. So they know where they can get the help they need. And then we monitor this too, to make sure that, you know, are you going to your appointments? What are the difficulties in maybe getting there? Maybe you don't have a ride. We help with bus passes so that they can get there. Trying to help them be more independent also. I'm your case manager, yes, but I don't always need to do these things. I can help teach you to do them for yourself. The covered services that we have, adult mental health, targeted case management is a billable, have four core billable case management activities. So when we're doing case management, we want to make sure we do the assessment, which is the functional assessment, the planning, make sure that we, you know, goes right back into their plan and everything they need, whether that's here or if that's outside of the county, because sometimes those services aren't available here. Referral and linkage, sometimes we, you know, have to make the referral, but sometimes we can just give them a list and they can make their own phone calls. So a lot of these people, you know, teaching them again to be independent and not need our services, but sometimes they just need a little help to get there. And then coordinating and monitoring the service delivery. Are they getting the services that they need? You know, how can we help you continue to stay on your plan? Eligibility, the county is fiscally responsible and shall provide case management services for all adults with the, and then here's the real identification. Eligibility is that they have to have a persistent and mental health illness, and that comes in their DA. That explains their diagnosis and kind of tells you where they're at, where they can go, and how we're there to help them get there. All adults seeking case management need a complete diagnostic assessment, like I talked about. It's got their history and diagnosis, and then using the diagnostic assessment is really key to their treatment plan. And then the other piece to it is just sitting down talking with them. What is your history? What have you gone through? Where do you want to go? What do you want to do? And how can I help you to get there? Sometimes they don't know, but once you start doing that plan, oh yeah, this is what I want to do. Maybe I want to go back to school. Maybe I want to work somewhere else, you know, and so it's just helping them get from point A to point B in the easiest way. And it's based on really what they want. So that's the voluntary piece. Most of my clients are. I have worked with commitment, which is a whole nother ball game. And that really is all about getting the help that they aren't able to do for themselves or quite don't understand what they need. And so sometimes we need help with doctors and therapists and the legal system to really get them to a safe place. And that's most important. Case management in Cook County. In Cook County, adults can request case management or referred from other sources. The adults may be in a mental health crisis or needing assistance, which impacts their lives. Many needed services are not available in Cook County. We all know that, and we are very lucky to have networks out there that we can refer to. And then I guess that moving forward, it would be great to have another mental health case manager to work with. But I really want to talk about this team because we all work together to get our clients the best. If I can't do it, I will refer. If I have a question, because this is still new to me also, I refer. I ask questions, and that's how we work together as a team. Develop skill building resources, we do need that, but we all, with our clients, help them with working on skills. Most of them have skills if they've been in therapy for a while. It's like, well, what have you learned? Let's use those things that you already know. Provide more community education on mental health and recovery. A lot of times, mental health is, people don't look for the help because they don't know what to do, or they're afraid, or the stigmatism. So getting out there and making ourselves more available to the community, or showing them and teaching them how to ask for help in a positive way is really important. Collaborative community effort to address safety and well-being to reduce mental health crisis and suicide across Cook County. Next slide, I think. Okay, and so that's part of a lot of what I do, just really working with people to get them to a safe place, keep them out of crisis by having a plan. And then hopefully they're not in case management for too long. And if they do leave, we always let them know that, you know, if your case is closed and you need us, we're always going to be here. So, thank you.
Thank you, Dana.
Thank you.
I have a question.
Yes.
Dana, you have the diagnostic assessments, and then do you do the functional assessments?
Yes.
And how long does it take? Like, is it a day, a week, or how does that work?
Functional assessment is just assessing, you know, where are you at, what are your skills, what do you already have in place, and then we build on that. The functional assessment tells us what to build on as far as services and things that they don't have. So how are you functioning?
And so this is primarily a conversation between you and the client?
It is.
And then you reach out if somebody needs?
Yes.
Or if you need help and help?
Yeah.
Okay.
And it's very client-driven.
Okay.
Yeah.
That's it.
Okay, thank you.
All right, thank you. Good morning, Brenda.
Good morning. I'm Brenda Port. I am the substance use co-occurring case manager. I've been in this field for almost 20 years. I am super passionate about substance use. Like, I get made fun of all the time because I get on my drug soapbox, so I'll just be real quick here. I do everything that Dana does, and then my clients have that extra weight that they carry of substance use and substance abuse. Most of my clients have legal issues, so I'm just kind of that person that does the case management. I become like the constant, because a lot of my clients just live in chaos a lot because of their addiction. So I'm that person for kind of helping them go through probation, help them with the county attorney's office, help them find the services they need, refer them to those services, and make sure they're as successful as they can be. Whether that be helping family go visit them, gas cards, whatever that looks like. And then I'm part of their plan on re-entry back into their community and their lives once they get all of that treatment complete. I'm just winging it. You can just flip, keep going. Yeah. So I think the biggest thing that I like to educate people is the world of addiction doesn't look like the movies, typically. Your neighbor, your mom, your sister, could have a substance use disorder. When I started in the field, it was very dirty. Your UA was dirty. You're on paper. Everything was very shame-driven in the recovery field. And I'm very proud that we as an industry are moving towards it's a disease. You're not a bad person, it's a disease. And I really applaud the resources that we do have in Cook County are very, very much like that and very built around that system. So there's no shame, there's no judgment. It just is what it is. Let's help you get the services you need. So what happens usually for my clients specifically is the judge, the doctor, someone in their life decides they need what's called a comp assessment. Used to be a Rule 25 back in the day. And that's that diagnosis they need to get into treatment. So we are incredibly lucky that we have Greg at Wilderness that does those. Small counties typically don't, like Lake County doesn't have anyone that does assessments right now. So it's a huge thing that we have that. That diagnostic or that comp assessment is their ticket into treatment. So that's when it's decided if they need inpatient, outpatient, what they need. And then we go from there. I think it's huge also that this community has a MAT program, the medically assisted therapy. It's hugely helpful. I think, again, back in the day, Suboxone was like a dirty thing for people. They're on Suboxone, like, you know, it was such a hush-hush thing, and it's just not like that anymore. They need that assistance to help get off those opiates. I just can say again that we are all about non-judgmental approach, understanding it's a medical condition. This is not a moral failing. They are not less than anyone else. So the future of substance use in Cook County, hopefully, is I would love to see to develop, support, and train peer recovery specialists, which can just be more boots on the ground and be like a skills person, help them in that way. I would like to see Red Road for Women recovery group, felon friendly, that's such a dirty word, but it's hugely impactful to my clients that have a felony record because a lot of treatments don't let them in. And so it really becomes a major issue when they're court ordered to do all this stuff and I can't get them anywhere because no one's taking them. So that is a huge thing for my clients right now. I would like to see more violent offenders go into drug court here, go into CERC. They take misdemeanors right now. I just think we need to serve the most, they're the ones that need the most support, is people that have felonies and a long history. So John and I are gonna make a pitch in January for the CERC court to relook at who we're letting into CERC and what that looks like for the county. I think we have Andrea Orst and I are working on some drug take-back events so we can kind of see what's out there. We don't have really good numbers. I come from working for the reservation in Fond du Lac, and we used to give lock boxes for the elderly to keep their opiates. I would like to see that developed here. And then just more public education. I think that's it.
All right.
I'm confused, I'm not confused. Could you define what we don't have really good numbers? What were you talking about?
We don't have very good data in Cook County about the overdose rate in Cook County and what drugs are being taken off the street. So we're working with law enforcement and the emergency room to work on those numbers.
All right. Commissioner Storley.
Thank you. Thank you for that report, everybody. The Red Road to Recovery, is that based from the South Dakota plan?
It's a Native American.
Okay.
Yep. Mm-hmm.
Yeah, okay, good. What would you list as substance abuse? Alcohol?
Great question. In Cook County specifically, what I see is probably alcohol first, then meth, then opiates. Very frightening fentanyl and xylazine are now in the drug supply, so that's a major.
What was that called?
Xylazine? It's a new drug in the drug community. It's not a new drug. It's a horse tranquilizer. You can get it off Amazon. And drug dealers are putting it in drugs because it's really heavy. So things that are purchased by weight, it makes them more money. The problem with xylazine is it doesn't work with Narcan. So if you overdose, your respiratory system is going to shut down, and if no one rescue breathes for you, you're probably gonna not make it through that event.
Would you consider marijuana in the future as substance abuse?
My industry is marijuana is kind of going into the alcohol category of, with it being legalized, there's not many referrals coming in for marijuana.
Yet.
Yeah, not yet. Yeah.
Thank you.
Yeah.
Other questions? Commissioner Hawkins.
Well, I do, but I think if they're going to be for me more for John at the end. Yeah, you might answer it.
Well, so I just have a question on, you made the statement, your UA was dirty? What's UA?
It's a urine analysis.
Oh,
Yep.
okay.
Yep.
And then CERC stands for what?
Substance Use Recovery Court. It
Yes.
used to be drug court back in the day.
Yeah, okay. And when Greg Barnier does an assessment, what's the time frame for him? Like, he sits down and fills out a form, or?
So he meets with the client, and it takes anywhere from an hour to 3 hours, depending on their age, their substance use. He does a very thorough interview. Then it probably takes him a couple hours to type the report up, and then he usually refers them to me.
Okay, thank you.
Yeah.
And there might be a process of gathering collateral contacts as well as a part of that assessment, reaching out to family that the client has signed a release to be able to contact, or other medical providers.
Great. Well, thank you so much.
So I just wanted to include some kind of historical data about what our service volumes have been at Cook County for the last 5 years. And you can see that we're actually fairly consistent. I would attribute the kind of up and downs as probably related to staffing more than anything else. I do think children's mental health has kind of gone down a little bit over time, but I suspect that as we have a full team here and they're providing the kind of work they're doing, I expect those numbers to go up in 2024, because I think there'll be more families who are going to say, oh, they're doing something different, and other kids I see are doing better. I want some of that same experience for my children. And I think we're going to, again, experience our interaction and our collaboration with the school systems to have that same positive outcome and effect. Because I think we'll see where we do better together will start to become our reality, and then we'll just see volumes grow. Chemical dependency, you'll see a pretty big jump in 2023. I think I would attribute that to Brenda. And her history with law enforcement created a lot of alliances right away. She was familiar with and is familiar with the court systems really thoroughly. And so I think we've seen a lot of collaboration that has really developed with our parole and probation officers, as well as with law enforcement already. And then our adult mental health has been pretty steady, but again, I think as Dana has identified, we are down that FTE, so we have one position that is unfilled, and so I expect once we get that hired, and especially as we get the mobile crisis response position hired, you'll start to see an integration occurring across the whole spectrum. Mobile crisis response will feed adult mental health, it might feed children's mental health, and vice versa. Adult mental health will help identify people who might be at risk, and so the mobile crisis response team will have them on their radar, so we'll be able to respond to them more efficiently. A lot of our work currently in the mobile crisis response area is developing the collaboration with North Shore Health as well as law enforcement. So we're getting the calls kind of routed the appropriate pathways to address the mental health crisis versus the criminality of an event. It's often the same thing, or it's happening at the same time, right? Somebody is doing something that's disruptive to the community. They are probably breaking a law, but there's a mental health crisis that's underneath that and right there present. So if we address the health issue, we can eliminate the criminality behaviors over time. And so that's really then why the focus for the mobile crisis response team and this whole team is to really work with those individuals to reduce that other community disruption, create more stability and life satisfaction for those parties involved, as well as those associated families and loved ones of those individuals. Probably the last slide, Melissa. Before I talk about this, though, I guess I want to, one thing that was not articulated on any of these slides is we talked about the statute, and we talked about, the mechanics of what case management is. But for me, what I think the success is for case management is about the relationship that the case manager builds with the individual. That individual comes back and participates with the case manager when they have trust and confidence and faith that that person is not going to steer them wrong, that they're feeling respected, they're feeling heard. And so that relationship that gets built is I think that's the secret sauce that carries people from needing services to not needing services. And because very often, a lot of what we see in behaviors is about expression of, I need help. And so violence, substance use behaviors, mental health behaviors, psychosis, are really the body trying to say, and the individual trying to say, I'm not managing well, I need some assistance here, and I'm looking for my community around me to assist me. That historically happens, that generally happens within a family system or within a community, but we've got people whose brains don't kind of function in the same way, and so they're unable to kind of navigate those pathways themselves. So we need these additional interventions to help them find that, more stable place. So for me, it really comes back to the relationships, and so while we've identified that, and it's a common phrase that Cook County is lacking services, what we're really strong in is a relationship building. That's what can carry us through a lot of these. With a lack of other services, we still find ways to help the individual because we're really emphasizing the relationships that are intact across our region. So my final slide then is, kind of what are we looking at going forward? Well, I really want to get these two people hired. I really want to get these two people hired. And finding the candidates with the appropriate qualifications and skill sets, because this is a complex space, and we can certainly train people in, but if they've got the skills in the front side, that'll certainly help us get there quicker. This new team, I think they've quickly kind of moved up to capacity. They're busy. They're busy every day. So that's one of our challenges. And you heard them all talk a little bit about their future orientation and what they're looking for. Our program development is getting hindered right now because we don't have these positions filled. We're unable to kind of take those next steps to really build out a more comprehensive mental health response system. And I think some of the other challenges they're just going to be present in our county, forever, and it's not just unique to Cook County, is the unmet and unrecognized need that's embedded in our communities and within our families. There are a lot of people out there struggling, and they're just unknown to us. So we want to somehow make ourselves more visible and accessible so people know that they can reach out to the county and get some assistance, and that's going to be a positive experience versus a shame-filled experience or a dissatisfying experience. Poverty within our county is always going to be another contributing factor and a complicating factor for folks because money does help us create access to health care. And without it, it's just, there's many variables that prevent someone from really taking that step to seeking assistance. And then I think, again, you kind of heard that our local area, we don't have a comprehensive system. We're very similar to Lake in that respect. County, and so we really rely very heavily on St. Louis County and some of those other surrounding communities to help us get that whole comprehensive approach. That's going to be an ongoing challenge, but I think we need to continually kind of think about and how do we break down the barriers to that accessing that comprehensive system. And so that's a future, as Brenda likes to say, it's a 2024 problem. So we'll just keep working on it across 2024. So that's our full presentation. I want to make sure that I answer your question if I haven't, Commissioner Hawkins.
Yes, thank you. This is an area that I struggle with all the terminology and who does what, so I really appreciate you laying it out in a clearer manner for me. And I guess I like to take notes because I think when I write, and then I write question marks here for clarification. Case management, you said, was a defined period for both adult and children's. I'm wondering, what is our average length of time that we provide services?
It's a great question, and I don't have that data for you.
Okay, I'm just wondering if it's month or 3 years or?
Oh, no, it's going to be longer than a month.
Okay.
3 years is not unusual. I would like it to be less than 3 years, but I think that's always going to be dependent upon the individual.
Okay.
I think, and it's going to be somewhat dependent upon which service we're talking about. Brenda has pretty short interactions, or brief interactions, I would rather say, that might be a few months long, because people get started, they get into treatment. After they finish treatment, she might do some additional coordination, and then they move on and they continue their working towards recovery, and they don't need our involvement. But she's got a caseload, some other people who have been on our caseloads for a very, very long time, and they have complex presenting issues of both substance use and mental health, and those two treatment programs or processes are not necessarily easily integrated. The state and across the country, we are trying to build those systems differently so we can do both mental health and substance use recovery services simultaneously. But it's complex, like so much of other parts of the healthcare system. And they started decades ago independent, and so it just takes time to kind of rebuild that structure. Children's mental health, again, I think often a family or a school is going to make a referral when they're seeing something really, really alarming, and we'll get started. Those cases can be 6 months long, but they can also go multiple years based upon, again, what that diagnosis is for that individual. So it's a great question. I guess I'd like to come back in another year or so to give you some more specific
I was
data.
just curious, you know.
I have a follow-up to that, though. So you're planning to track this information?
I think we'll be able to track this information based upon the information that we put into SSIS. We'll be able to figure out when someone starts their services and when they complete their services.
Because to follow up to Commissioner Hawkins' questions, I had a lot of those questions on my sheet as well. How do you measure success in these programs? Are there numbers that allow you to do that or not? I don't need an answer to that today, but I think that's really important for us to understand so that we can continue to fund. Because I think there's always questions and just statements about not wanting to fund these kinds of things, but when you have that data, the data helps. So I'm glad we can get that data so that we can continue to do the good work you're doing.
I think we'll get more of that data over time, like when we get our mobile crisis response system operational, and we're starting to get 911 calls routed to the mobile crisis response system versus just deputies. Will start to give us more hard data around what is the need out there, and then what's the resolution. I think we'll have to do kind of a multi-layered analysis, though, because measuring success is complex. The individual is going to identify success. Cook County may identify success differently than the individual. Mm-hmm. Taxpayers are going to think about it differently, of course. But I think if we're seeing cases open and close, and then we're seeing those cases not reopen, I think that's a pretty good indicator of success. I think if we see our crisis calls responded to, and we see people getting to, again, they maybe get referred to adult case management at that point in time, or children's case management, that's going to be a success because we're adding now stability to their worlds versus that family struggling on their own and trying to navigate this by themselves. So that's a fantastic question. I think I'm going to also ask that I'll come back at a future point in time and we can talk about that with greater nuance.
Other questions?
I just want to clarify. So, let's see, case management, direct skills teaching, is that we talked previously about Children's Therapeutic Services and Support, CTSS.
Yes.
Is that what we're talking about when you say direct skills teaching?
It is.
So we are doing that.
We are. So CTSS is it's again a regulatory defined service that is defined by the state of Minnesota, and it's a reimbursable service, and it's a healthcare service, and we are capable of providing that service. We have the capacity, we have the foundation to be able to do it, but currently we have in this last year. I modified kind of our approach within behavioral health is within the case management role, I'm expecting each case manager to be able to provide skill work with those individual clients. The model that was getting discussed when I was hired was building out CTSS as a separate service from case management and ARMS as a separate service from case management. ARMS and CTSS are similar in nature. One is for adults, one is for children, but it's that skill development and building. You heard Dana talk a little bit about modeling, and you heard Al and Merrisa talk about the importance of those groups and modeling there. We all learn as a species from each other. And so when we are in environments where others are being successful and we're seeing people navigate complex social environments, then we learn from that. And so we're trying to model that through a variety of different experiences. So the client who has not really been able to do that successfully across their lifespan have some more capacity to do that. And so we talk about that from the functional assessment into the goal plan about how they can improve their functioning. We don't use those terms necessarily. It gets translated into, improve your relationship with your mom would be the goal and the activity. But that is very much about skill building and is very much about helping someone build the foundation for autonomous life and a healthy life going forward.
Thank
Does
you.
that help?
It does, it really does, because I was confused, case manager and that other, I didn't understand how it all worked together. So we do provide those services and we are being reimbursed for those services.
We do not provide those services in the formal manner of ARMS or CTSS. And so therefore, we are not getting reimbursed for CTSS or ARMS. We are providing those services as a function of targeted case management within the scope of each individual employee's responsibilities. And the reason we're not providing those services right now is we don't have the staff or the capacity to manage those services effectively. They're regulated and they're regulated healthcare services. And so when we build those services, we have to be very thoughtful and planful about how are we structuring that, and do we have the right client data management systems to record that data? Do we have the right licensed personnel? Do we have the time to support those individuals? We are putting some of those pieces into place, but as I talked to Allison this year, I just said, we don't have the capacity to do this right now. We need to get some other core things in place first, including getting an adult mental health case manager and the mobile crisis response position hired. And then we need to keep our team stable, and then I think we can start showing what the volume would look like, and we'll have to develop a strategy about how we'll recruit the qualified people to fill those positions, and so they're successful when they get hired.
So those positions then need a certain certificate or licensure? Is that what-
They do need some certain qualifications. Some of those positions need licensure, some of them do not, but they need to have licensure support. So as an example, a diagnostic assessment is necessary for both a CTSS case and an ARMS case.
Okay.
You've got to have a mental health professional who can do that diagnostic assessment. Then when that functional assessment is needed and you're talking to that individual to figure out what their needs are, that's done by a mental health practitioner, but they work underneath the license of that mental health professional. So similar to how a doctor gives orders and a nurse will often execute some of those orders, or there might be other healthcare providers that are working within a clinic or a hospital to help deliver those healthcare services, ARMS and CTSS are going to be very similar. They really are a healthcare service that's getting provided in the behavioral health world. And so so that's what I mean, is we have to be really prepared and ready to do that well, because while I personally find it really, really demoralizing and difficult to start a project with such high aspirations and then falling short of those goals. It really doesn't help anybody. We don't really add a lot more value to the community until we're very thoughtful and prepared to deliver it well. And so that's just one of our challenges, to have sufficient staff with the appropriate skills to be able to deliver that.
Okay, thank you. My last thing, I think is my last thing, was about, I'm wondering if you can provide an update about the crisis response. And we had it, you came to our committee of the whole session, and we weren't able at that time to have somebody boots on the ground actually doing the work. How close are we now?
So Matthew was with me at that presentation, and they gave their notice shortly after that. I have been partnering with Andrea Orest with Public Health to do a lot of our kind of foundational work to build those collaborative working relationships with law enforcement and North Shore Health, as well as with Human Development Center and Grand Portage Human Services. I think we're making really significant progress in the foundation work that's getting done. We are getting deeper into how do all these 5 entities interact with each other to provide that crisis response. And we're getting closer to having those communication systems work more effectively, and so we're able to have the appropriate response for that individual in crisis. But we're pretty stymied on being able to put a lot of that into implementation because I don't have that position filled. And so we have not had a lot of applicants for that open position, and so we'll be kind of doubling down in January about trying to figure out what we can do next to get that position hired.
Well, and I was wondering if, I know we keep advertising, it's on the list, but if we didn't have programming or a process in place to actually do the work, I think that was Matthew's, that's what I got from that discussion, was he was working on how to develop those relationships and actually do the work. And I'm wondering, I wouldn't want the next person that we hire to be in the same position.
And that's partially why I've been working with Andrea in the way I have, because I want that foundation laid down so when that position gets hired, they are able to now start going out and interacting with the community and the individuals in need. And when they're interacting with law enforcement and North Shore Health, there's already a defined environment and culture of what their role will be. So I'm preparing for when that position is hired, we're going to have success when they actually get started.
Thank you.
Yes.
Commissioner White.
Long time to hold on to my thought.
I have paper and circles.
When you have, you're helping a person, like you, as an example, you said, improve a relationship with their mother. I'm assuming this is in my mind, it was like a young adult having a better relationship with their mother. Do you speak to the mother also? I mean, are they part of, I can see where you would have, that might be a...
Complex.
Oh, yeah, a few years of things happening. So do you bring in the other people that would be part of this for this particular person?
As much as we can. And because as a species, we don't really thrive as individuals. We thrive as a part of a community and people around us. As mammals, we're just hardwired that way. Horses, all mammals are really wired that way. So we're no different in that respect. So when we do need those family relationships, or if in the absence of healthy family relationships, we need other relationships for that individual to, move towards that, on that recovery road. So yes, whenever we can, we will include family as much as possible. As adults, and we would do that with adults. And, child-parent relationships continue to evolve across a lifespan, and they can continually improve across a lifespan, or they can get worse across a lifespan. Mom could, I can speak from personal experience that my mother raised 11 children, but as all of us were out of our homes, some of her earlier life experiences came back to affect the way she was experiencing life. And her and my dad went through a very difficult period for about 10 years or so, and it was her mental health. And she didn't choose it that way, right? This was not a failure on her part like it is for anybody. It's just something that her brain said, there's some unresolved stuff here that we need to work out. And so relationships within my family were challenged during that period of time. And but my mom stayed with it, and my dad stayed with my mom, and we kept working it through. And my mom got to a better place before she ultimately died about 10 years ago. That is true for all of our family situations. And so, yes, that relationship with your mother can take place at between 7 and 35, or it can take place at 45 and 65. And this team is going to try to meet every individual as to whatever their needs are, wherever they are at in their life spectrum.
Well, John, I want to thank you for just a wonderful explanation of that, and a reminder to all of us that it's not just at adolescence or just with substance abuse. Things go throughout our lifetime and throughout the spectrum of life.
And we can't exactly plan for it, right? When someone close to us dies, it impacts us. That can be one of those things that triggers us to move into a space where we're not as healthy as we may have been able to function at previously. But I guess for me, Commissioner Sullivan, it's always about those events also become the doorways for us to become bigger and stronger and more capable. And that is true for all of our health experiences. So, and I think that's what drives this team. They have that belief, and they're ready to meet people in those hard moments and work with them to get them into better moments and leave that pain behind them.
Absolutely. Well, we appreciate your team. Your presentation today was absolutely fabulous, and thank you for all the good work you do for the people at Cook County.
Thank you for your time and listening to this. We're all kind of geeks about this, so we're happy to talk about it. So thank you very much.
Well, we'll have you come back because we're kind of geeks wanting to learn more about it.
Cool. It's a deal.
All right.
Thank you.
Thank you. All right, we'll move on at this point to our director's report.
All right, and before the behavioral health team fully leads, just want to echo my support and gratitude for you all being here this morning. Your passion and your commitment is evident in the way you tell your stories about your work and support of residents in this community. So thank you all.
Thank you.
All right. Starting as always with staffing updates, you received an updated organizational chart in your meeting materials. We welcomed Leah Leonard since our last meeting. You met Leah this morning. Again, we are now fully staffed in the accounting team for the first time in 6 months. So very grateful for Leah and the skills that she brings to this role with the department. We do continue to recruit for 4 other vacant positions on the team. 2 of those you heard about at length this morning, both being on the behavioral health team, an adult mental health position that's been vacant for nearly a year, and the coordinated crisis response pilot position that has now been vacant for about 6 months. We are also recruiting for 2 case aid positions on our team. These are support staff that provide a variety of clerical, administrative, and programmatic support to staff throughout our department. Those vacancies were due to an internal promotion and a resignation within the last 2 months. Those positions closed on December 12th. Both of those require merit system testing as a component of the application process, so that test was on the 15th, and expect to receive a list of referred candidates for those 2 vacancies yet this week. Governor Walz last week proclaimed Wednesday, December 13th as County Tribal State Health and Human Services Worker today. So before I move on to my department updates, I'll just read the proclamation from the governor. County, city, tribal, and state health and human services workers are dedicated to improve health and providing outstanding public services to the people of Minnesota through their prevention efforts and program administration. County, city, tribal, and state health and human services workers must meet the highest standards of job performance. The duties performed by county, city, tribal, and state health and human services workers require a variety of skills to provide services to clients, communities, and the general public. The nature of federal and state legislation relies on county, city, tribal, and state health and human services workers who continually expand their knowledge, skills, expertise related to their profession and the needs of the communities they serve. And Minnesota recognizes the valuable public services that county, city, tribal, and state health and human services workers perform every day for the health, prevention, and protection of the people of Minnesota. So just want to again recognize the contributions of our team here in Cook County Public Health and Human Services, our partners at Grand Portage Health Services and Human Services, our contracted providers providing mandated services through purchase of service agreements at Sawtooth Mountain Clinic, providing community health and public health nursing services, and everyone else that I forgot to include, but is a part of that network of county, city, and tribal health and human services workers in our community. Moving on to my director's report, I want to start, before I get into some of the items for board action, to make sure that I recognize Pat Campanero for your service as our Public Health and Human Services Advisory Council Chair and your representation on this board as an appointed member representing that group. Very grateful for your service and support. Thank you. It's been quite some time now since we've had a formal COVID-19 update, but we have experienced a milestone in the last week, that being the first confirmed case of COVID-19 in the North Shore Health Care Center over the weekend. As a result, masks are now required based on the level of transmission within the care center. We had a meeting of the Aging Coalition yesterday afternoon, and one of the representatives, Hillia from the care center, asked, is there a plan to do some more outreach with families gathering around the holidays, reminders of how to access masks and testing supplies? So we put out a social media post yesterday with that reminder to community members that we do continue to supply masks and COVID-19 tests at Cook County Public Health and Human Services free of charge. Those are also available at Sawtooth Mountain Clinic and at Grand Portage Health Services. Right, so a few updates from the areas of mental health promotion and substance misuse prevention, childcare initiatives, and then a few updates on or a little background on some of the items for board action before you this morning. Within the last few weeks, our department put out a press release promoting the use of 988 as a suicide prevention text and phone line. We put that together in partnership with Grand Portage Human Services, as they too are a part of our local crisis response system. We also put out, so a focus of that press release, which you all should have received a copy of, was more detail on what to expect when you call or text 988, and that even though this is a national hotline, by identifying where you're calling from, you'll have the opportunity to be connected with a local mobile crisis responder. We also, in partnership with the Cook County Sheriff's Office and again Grand Portage Human Services, put out a media release related to overdose prevention information, a public service announcement on some of the substances that you heard this morning that are being found in the drug supply in Cook County and up the shore, with information on how to access some of those overdose prevention and reversal supplies that we have available here at Public Health and Human Services, those being Narcan, naloxone, xylazine, and fentanyl test strips. We make those available free of charge from our front desk. We're working on ways to make those supplies more readily available That might include not having to come to the service window to request the materials, but by having them available in a locked box of sorts in our lobby or in areas throughout the community. Those materials are also available through Grand Portage Human Services as well. So again, the efforts to increase access to those materials, increase our public information, outreach, information sharing, continue both at a local and regional level through that Rural Communities Opioid Response Program. Also in the area of substance misuse prevention, we hosted an open house on November 27th to build a coalition of professionals and community members that are dedicated to preventing substance misuse in our communities. There were 5 in attendance at that open house, but we're continuing to conduct outreach and garner interest in developing a community coalition to address substance misuse. Likely we'll be hosting some community forums, doing some community readiness work regarding prevention work, likely in February of March of next year. We'll be hosting forums throughout the county similar to some of the age-friendly initiative listening sessions that we led in partnership with Care Partners this fall and winter. I'm going to be working with Administrator Yorkie on developing a more detailed framework for decision-making and sharing information publicly as it relates to our opioid settlement dollars. So expect more information to come through this board or the County Board of Commissioners early next year. As a reminder, in June of this year, this board approved allocating approximately $18,000 of what we have received to date towards some of those overdose prevention supplies and making those accessible through Public Health and Human Services and Grand Portage Human Services. Any questions on that before I move on? Yes, Commissioner White.
5 minutes ago, you said 988 that it's routed by phone number to our location. Have they figured out what to do with cell phone numbers when people move here from Arizona and they have their cell phone numbers? So you're routed to Arizona, and then have they figured that out yet, how to minimize the amount of time it takes to find out where the person really is?
Thank you for your question, Commissioner White. So unlike 911, which uses geolocation based on an individual's location and associated with their cell phone, 988 is based on the area code. So as a part of the triage and the protocol for answering those calls, whether they be by phone or by text, one of the first questions that the responder on the other line will ask is, where are you calling from and what is your tribal affiliation, so that they can ensure those calls are routed appropriately. Yeah.
Okay, thanks.
Great question. Any other questions for Allison?
I do have a few more updates and some background on our items for board action. Want to share that we received notification from the Department of Human Services last month that we, Cook County, will be on a performance improvement plan for child support services with regards to the percentage of open cases with paternity established. So the Department of Human Services has defined performance measures for all counties and tribal nations providing human services programs that they meet an expected standard of performance across maybe a dozen areas. Within child support, one of those areas that's measured is the number of open cases that have paternity established. So within the time period that was measured, Cook County, again, we are contracting with Carlton County to provide services to Cook County residents. We dropped below that threshold by just 1%. The same thing happened in 2018. And the very next year, in 2019, while under that performance improvement plan, we increased that percentage to back over 100%. Don't ask me how it's possible to have more than 100% paternity established, but we can bring Dan, who is a supervisor with Carlton County Support and Collections, to provide more of that detailed programmatic information. I think what's most important for you all to know as elected commissioners is that with such a small caseload size, even one case can make the difference in whether or not we meet that threshold. In 2018, we filed a claim for extenuating circumstances as caseload numbers were dropping, but we were denied as caseload numbers were dropping across the state. So Dan, in his communication to me, stated that he is not planning on filing a claim for extenuating circumstances, as these are conditions across the state. He did complete the performance improvement plan forms. I had an opportunity to review those and give feedback on them. One of the factors that is contributing to our not meeting that performance threshold are waivers in place at a federal and state level with regards to medical assistance and maintaining eligibility for enrollees during the pandemic. You heard from Dagmar Smith last month about the enormous effort that our team and counties throughout the state are undergoing to unwind some of those program waivers, redetermine eligibility for people who haven't had their healthcare eligibility renewed in a number of years. So again, that's contributing to our performance dropping below that threshold. Dan also referenced some training and staffing conditions that are contributing to that as well, and that as the team becomes fully staffed, that he expects that performance will again move above that performance threshold. All right. I have some updates from Nancy Deming, our child care coordinator, but I'm going to hold off until Commissioner Storley gives her report from the Child Care Solutions Subcommittee, and then I can fill in some of the blanks in terms of the projects that Nancy's working on. So I'll move, one more thing I'll mention before I start speaking to the items for board action is a media release was distributed just this morning promoting the need for more foster care providers in Cook County and with information on how to become a licensed foster care provider. All right, so items for board action. The first item before you this morning is acceptance of a Department of Human Services Live Well at Home grant for the Collaborative Transportation Solution Program. You heard from Martina Johnson within the last month with a request for support to MnDOT to provide additional support towards this initiative. I expect that we'll be sending out a media release again in the next week with more information, including on the grant funds that we were able to secure from the North Shore Healthcare Foundation to help supplement this project. The request before you today is to simply accept the DHS grant agreement to allow us to accept those funds, purchase that vehicle in 2024, and continue the work of working across systems and within a county on developing this collaborative transportation project, which I'm excited to share has a name, a tentative name. It's Boreal Partners Transit. And again, the goal of this project is to purchase this lift-equipped vehicle that can be used by volunteer transportation providers in Cook County, both through the in-home support program and care partners of Cook County to expand access to residents who have mobility needs. Martina, as a part of this project, has been participating in a training academy through the Department of Transportation, getting support on how to develop and communicate about this project. She put together a great video that explains it. I had hoped to have that all ready to go out in a media release before asking you to accept this grant contract today, but just weren't able to prioritize that. But really excited about this project and that we were successful in securing these grant dollars. Any questions about that for me, or before I message Martina to come back me up?
I'm just really excited to move forward with this. We have such huge transportation needs, and this will be a great help, and I like having a name, Boreal Partners Transit. It's wonderful. Questions?
And if we could refrain from ever calling it BPT, that would be really nice.
We'll do our best,
Boreal
Commissioner.
Partners Transit. Let's, because otherwise it again sounds like something you would eat.
All right, other questions or comments? If not, I'd entertain a motion.
I'd like to move this.
Thank you. Appreciate that, Pat. Is there a second?
I'll second.
Thank you, Commissioner White. We have a motion and a second. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries unanimously.
Thank you.
And thank Martine for all her work.
Yes,
Oh, my gosh.
exactly. This has been a long time coming.
Yeah.
I will, yes. Martina's been an incredible champion for this initiative and demonstrated incredible leadership and partnership throughout this project.
Absolutely. All right. We'll move on then to our next item for board action.
So the next item for board action is a request to amend the current joint powers agreement in place for the Electronic Document Management System, or EDMS. I might have to use that one a few times because Electronic Document Management System is a mouthful. You may have noticed an update to the agenda yesterday to include a memo attached on your agenda under item 5B. This is a memo from St. Louis County that was received on Friday of last week. That includes a commitment to continuing to provide IT support to all regional counties through December 31st, 2024. So taking a few steps back, in around 2013, 2014, when I first started my work with the county, and including work on the economic assistance team, Cook County, along with all of the other regional counties in the Arrowhead, entered into a joint powers agreement to purchase an electronic document management system to manage the increased workload associated with our economic assistance and healthcare programs. The goal of this pilot was economies of scale, to be able to purchase into a technology tool that otherwise a small county like Cook County would not be able to afford, nor have the technology expertise or project management expertise to execute. We have been in this regional joint powers agreement since that time, operating within the same system as a region since 2013. Beginning in the last several years, counties throughout the region, primarily St. Louis County and Carlton County, began exploring electronic document management systems for social services as well. Some of our peer counties in the region are experiencing a high degree of data requests for social services files, and the process of pulling that from paper case files, which we still maintain in Cook County and in many counties throughout the state, is arduous, to say the least. We have been having discussions since probably mid-year last year around collaborating on a shared document management system for social services, with counties throughout the region having varying degrees of readiness or necessity around making that change. St. Louis County, again, has been hosting the technical environment, providing IT support, training support to Cook County and other counties throughout the region for economic assistance and healthcare programs, and they are actively moving forward with a phased transition of moving all programs, social services, economic assistance, and healthcare, into CaseWorks. CaseWorks is a product that's used by, I think the latest number is over 60 counties statewide, so a majority of the 87 counties in the state of Minnesota are using this system. In absence of a statewide solution, we're really left to either find something on our own or develop a regional partnership as we have in the past. So the request before you today is not to purchase any additional software or expand the scope of our electronic document management system as a county, but simply to amend the current joint powers agreement to allow Cook County, St. Louis County, and other counties in the region to move forward with a transition to CaseWorks in calendar year 2024. We have begun conversations with CaseWorks, demos in terms of what the system looks like for economic assistance and healthcare, which is our priority and the area in which we will need to make a shift either to CaseWorks to purchase our own licenses and software in our current system or to find an alternative document management system. I don't think anyone thinks going back to paper files is a viable alternative. We are also looking at an EDMS system for social services for many of the same reasons of our other counterparts, counties in the region and in the state. The efficiency, the improved communication and workflow, the improved data retention and management that comes with having a centralized document management system. So again, we're meeting with Caseworks to learn more about the product, how this could work in Cook County. We're providing data on the number of users and current and anticipated program utilization for both economic assistance and healthcare and social services to get some estimates on what that investment might look like for 2024 or 2025. Again, in terms of the fiscal impact, we have the commitment from St. Louis County that they will maintain the current environment. We have $13,400 budgeted for economic assistance to maintain the electronic document management system that we currently have in place, with an additional $1,679 budgeted towards the expense for child support services associated with our contract with Carlton County. That was a lot of information. I'm happy to take any questions.
I'd just like to share that at AMC, at our recent annual conference, there was a huge discussion about all the challenges that counties are experiencing with data management. And I really appreciate the chance to, look at Caseworks and get on board with this. I think it's just a struggle that all counties are having. And anything we can do to help our staff is something that we should consider. Yeah. Any other questions? Commissioner Hawkins.
Yeah, it makes sense to transition, it sounds like, to Caseworks. I'm wondering how that works with our IT department and what's the time frame? I mean, if you like it, we need something. We have to find something in the next year. So I'm just wondering maybe what your time frame is for getting on board with this.
Sure. So a rough timeline in terms of my goals is to have these demos with Caseworks with our staff and supervisors within the next several weeks. We have, I think one is scheduled right now, actually, with our economic assistance team and healthcare team. And providing the data to Caseworks in terms of our utilization, what that budgetary impact might be to make this investment in 2024, or if we need to phase this into 2025, looking into revenue opportunities to offset the expense. The expectation is that we would be investing in Caseworks as an alternative to the current system, so that would be offsetting that $14,000 or so that we currently have budgeted in 2024. I have yet to have conversations with our IT support team in terms of what this transition would look like for them. I would not anticipate that this would create additional workload for the IT team in the long run. There may be some transition support where we would need the support of Rowan and his team to help see this through. But what I've heard from my peers in the region that are actively in transition with Caseworks is that they provide a lot of that transition support in terms of the data migration, the technology, the training, the workflow development, the business development, either through their team or through a contracted vendor that is helping with that transition.
Okay, I just want to make sure Rowan knows this is a possibility down the road and make sure he has input of anything we need to think about that we didn't think about.
Absolutely.
Other questions? If not, I would entertain a motion.
I'll make that motion.
Thank you, Commissioner White. Is there support?
Support.
Thank you, Commissioner Storley. We have a motion and support. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries.
next up is a request to, again, amend a grant contract, in this case with the Department of Employment and Economic Development, or DEED, to implement projects related to the Child Care Economic Development Grant Program. This was a grant that our team wrote in 2022 in partnership with the EDA, that provides funding to support childcare business development and providers in Cook County. The request before you today is to simply amend that grant agreement to extend into Q1 of 2024. So the current contract deadline is December 31st. Our request is to extend that into March of next year.
Questions for Allison? Or any comments? Pat, you and I were part of that discussion back in 2022. Commissioner White, question?
No.
All right. I would entertain a motion.
I would move.
Thank you, Pat. Is there a support?
Support.
Thank you, Commissioner White. We have a motion and support. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries.
And the last item for board action this morning is requesting your approval to add Leah Leonard, our new accounting technician, as account signatory on all Public Health and Human Services representative payee accounts at Grand Marais State Bank, effective immediately. You approved a similar request earlier this year to add Plumman as an account signatory. This is a necessary function of her role as the social welfare representative payee for individuals who have been determined by the Social Security Administration as needing that level of support for managing their finances.
All right. Any questions for Allison? If not, is there a motion?
So moved.
Thank you, Commissioner Hawkins. Is there support?
I'll second it.
Thank you, Pat. We have a motion and support. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. All right, thank you so much. We'll move on to our committee reports, and we'll start with active living. Deb?
That was a great meeting. Where are my notes? I had them last time with me. No, the active living group, I'm going to pass on that one until I find my notes.
All right. Sounds good. We'll move on to the Arrowhead Health Alliance Joint Powers, and Commissioner Mills is not here, but we'll ask Commissioner Storley to give us a report. Actually, you can do both Arrowhead Economic Opportunity, AEOA, and Arrowhead Health.
Yeah, since I'm his alternate, I'm doing a poor job of finding the reports, so why don't you move on and I'll come back. Wait a minute.
All right.
Okay, AEOA did not meet since the last update. Okay. And Arrowhead Health Alliance, tensions and disappointments are high with Thrive's apparent lack of interest in tribal concerns regarding Birch Tree Center name-taking. That's all
right.
he wrote.
And we'll move on to the Arrowhead Regional Corrections. Commissioner Hawkins?
We had our last meeting Friday in Duluth, and we talked about the AMC award that was given for their, I don't have it in front of me, the probation services, and we're excited as the board to explore opportunities to expand that to the other counties, and that's all otherwise it was just general business.
All right.
Nothing new to report.
Thank you. Child Care Solutions, Commissioner Storley.
Okay, back to my other page. The good news is that the cooperation station has reopened. So that's good news for the community. And there's a Northwoods Play School opening up at the Congregational Church. And Birch Grove Seedlings Program is going to be licensed for childcare. So we're moving along with our little room there. Let's see. We have so far 100 children that have been served through November 20th. That was before the cooperation station reopened. And then there was some discussion about how to send out information about different meetings and events that's happening. So we went over, the Herald, the Northern Wilds, the Boreal, WTIP, North Shore Journal, county website, Facebook, all that kind of stuff. So that was a good meeting, and maybe Allison can fill in if there's any gaps.
I do have a few other things to share. Just a wrap up of the Cook County Wage Enhancement Program, Year 1. All eligible providers in the county and Grand Portage have participated and have had positive feedback about the difference that this has made for their programs. All are appreciative that this program is continuing into 2024 with that slight cost of living increase. This program is unique within the field and is garnering much interest around Minnesota and beyond for its innovations. Nancy is our Community Child Care Coordinator in partnership with Early Connections, previously called the Resource Hub, are participating alongside the Build initiative to film a documentary highlighting the early childhood work that is happening around our state. The child care initiatives will be explored, as well as our ability to listen and connect to young families with services they need to survive. The film team will be in Grand Marais in early spring. This month kicks off our communications campaign, which will focus on recruiting new caregivers, providers, and volunteers to care for and teach our children. In collaboration with Giant Voices in Duluth, Cook County Public Health and Human Services will launch the Cook County North Stars initiative with a social media presence, print, radio, and digital outreaches as well. This campaign will last through the end of March 2024. Again, this is funded with support of that DEED grant that you accepted amending into next year. Cook County was awarded a $17,500 grant from the Northland Foundation to continue to identify and support the family, friend, and neighbor care providers throughout the county. And finally, want to recognize Nancy for all of her incredible work, but specifically her advocacy at a state level. She participated in a CARE Fellowship, which is the Child Care Advocates Ready to Emerge. This is sponsored by Child Care Aware, which is a statewide initiative, and the Minnesota Child Care Association, the Minnesota Association for the Education of Young Children, and Think Small. This is a year-long commitment for a group of 20 individuals who are passionate about early childhood issues and willing to share their voices and stories to affect change in their communities. That cohort meets once a month to network, discover new tools, and learn more about impacting the policies that affect families with young children. Recently, Nancy spent the day at the Capitol along with this group to learn firsthand how policies are made, the difference between a rule and a statute, the process a bill takes through the legislator, and also worked on increasing their ability to turn the stories that we hold for our community into calls for action that may influence our legislators. Nancy and the team also met with individuals from the Children's Cabinet at a state level, as well as the new Department of Children, Youth, and Families to talk about their roles in this work as well. Nancy reports it's been very engaging and enlightening to learn what other communities are attempting throughout the state. So thank you, Nancy.
All right, thank
And to
you.
this board for your support of the child care system in Cook County.
The only other thing I would add here is that although this is all good news, we have a need for childcare for infants. That is still a big, big, big hole in this community. So I throw that out there in case anyone's listening who has an interest in that particular want, where there's a lot of help around to help them get started.
All right, thank you. Community Health Board, Jenny.
Community Health Board, let's see. Had the annual meeting. There's an air of opportunity from legislative changes, maybe new, different funding sources through uncertainty could coincide with the change. That's the report.
All right. Our Cook County Local Advisory Council for Children and Adult Mental Health.
That's me.
Yeah.
Oh, what we just heard today,
Right.
I got to hear, and it was like enlightening. And the reason that's really important, may I have a better understanding, but just lately, I have been by someone saying, what's with that, very emphatically and not particularly excited, happily excited, what's with that social services, public health? Why do they have all these people? And so I was pleased to say, hold that thought. I'm getting a better understanding of what is going on, and it's very complicated, and there's good work happening, but stay tuned. That's all I could say to them, but that presentation was almost spellbinding. The little talking heads, I'm sitting here and I'm listening to this, and I'm thinking, look at that. And it was, I guess maybe it was their passion and their working together, and then understanding, case management is voluntary. It was all a brand new thing that was out there somewhere and now I understand it like at least 50%, but I do know, I feel as though we have people that are really committed to doing good work for our people, community people. So that was that. I remembered that one.
All right. So, active living.
Okay, I can tell you active living now. More or less. It wasn't as exciting because the conversation, we have a lot of sidewalks, we have a lot of this, people are walking. However, the population is aging. And for many people who walking was always a great thing to do, it's a little bit of this isn't going to happen. I am not going to walk from 5 blocks from one way to the other to get groceries and then carry them home or carry them back 5 blocks. It's not possible for many people as they age to do what they once did. And so Grand Marais and our county needs to continue to become more handicap accessible, more with the idea in mind that we all want to be healthy and be out there, but there will continue to be a need for motorized transportation, or maybe rickshaws then, but of something to help people with mobility issues that they're acquiring mobility issues that they never had before, for them to continue to be active participants in the community. But it was a positive thing. It just wasn't as exciting as the mental health one was. Okay.
All right. Well, thank you for that update. All right, Cook County Restorative Justice, Commissioner Hawkins.
That meeting is tomorrow. So
All right. Next time around, we'll have an update. Council on Aging, Commissioner White?
Oh, that group of people. I mean, they're just, the hub is a place to go if you want some good food, if you want warmth and you want support on meeting people, and even if you're not old, but even if you're just active, this is a place to pop in, bop out. They do fundraisers and all sorts of things, and they're doing really well. They are reorganizing, and it's been 1 year, and they have their feet underneath them. And it's been a long time since I've gotten to sit at a table with a group of people who are functioning with one goal in mind, and that is to make the Council on Aging, to make the hub a viable source, a resource for the community.
All right. Thank you. Emergency preparedness, we did not meet this month, but at AMC, I went to a number of activities, different workshops focused on emergency preparedness, and came back with a thought about having some type of a tabletop on what happens if our technology goes down. And so anyway, that's a thought that I have shared, and we'll see where that goes as a potential. But our next tabletop is going to be on wildfire, and that will be in the spring prior to fire season. So. All right, healthcare planning, Commissioner Storley.
We did not meet.
All right. How about NACO? I know you have a report from NACO.
Well, yes, I'll just make it brief. Normally, NACO is something that goes on in another state, And because the president of NACO is from Minnesota, Mary Jo McGuire is the Ramsey County Commissioner and also president of NACO. She brought the symposium to Minnesota, and I would say that this symposium was on our own mental health as commissioners, as leaders in our community, and just how can we have interesting conversations with our constituents to how do we handle situations that pose a way of maybe different thinking. So that's all I'll say about that. I hope that some of these ideas we can incorporate into some of our board training.
All right, thank you so much. Northeast Minnesota Office of Job Training Programs. Commissioner Hawkins.
Not having a December meeting, but I just want to verify, we did pass the new joint
Yes,
powers.
we did.
Did you get that signed and
Yes.
set? Good.
It's
That's
done.
the only thing that was on my list of things to double check today.
Absolutely.
Thank
Attorney Hicken helped with that.
Yeah, thank you.
All right. And North Shore Collaborative did not meet since our last update. Pat, Public Health and Human Services Advisory Council.
Our advisory council did not meet, but I would like to tell everyone that next month you're going to have a new person at this table. Frank Cielo is the new chair of that organization, and he will be representing the board here. I'm very excited to have him replacing me. He's very excited. He's already had meetings with Allison and I to make sure that this continues to be a very supportive environment for Allison's organization. And as I leave, I would just like to, again, pledge my support to Public Health and Human Services. They do a great job. They touch many, many people in this county. And I just believe that anything we can do to continue to support this organization is very important to our well-being. So that's it for me.
So anything for the good of the order? I guess I'd like to thank you, Pat, for all your
Thank you. It's
service
great.
and your
I
leadership.
love this job. It was great.
All right. Is there a motion to adjourn?
So move.
Is there a second?
Second.
Thank you, Commissioner White. We have a motion and a second. Any further discussion? All in favor? Aye. Opposed? Motion carried. We are
holidays to
adjourned.
everybody.
Happy holidays.
Everybody
To
show up
everyone.
for Grace's going away party.
Oh, yes.
Oh, goodness, for